Thanks for coming out and watching the oxymoronic Reddit Professional Show, where I showcase the best and worst of the internet. Here I comment on brilliant and hilarious comment chains regarding dumb shit on the internet for you to enjoy. Make sure to subscribe, hit the little bell button so that you get notifications every time we come up with a new video. Enjoy this week's show. Medical professionals of Reddit. When did you have to tell a patient, "I've seen it all before," to comfort them, but really you had never seen something so bad or of that nature? Probably too late to the party, but I had a lady come into the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood test results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. The patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone, and her body was twisted in a decorticate position, with her jaw locked open. Then the smell hit me, rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm, and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen and the skin was splitting like ripped pants. I removed her depends and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. The entire sacrum was exposed and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar. No surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. Years ago, my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review, and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked-out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts, since he had no idea how he would put this child back together. He also told me he used the films as a teaching aid. He's one of my heroes. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious, and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. Had to tell them we see worse often, which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. I work in gynecology and had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her vaginal area was completely red and swollen. He then so gently inserted the speculum to get a look, and immediate white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with the prescription medicine. That day, I learned if you smile while humming, it helps in suppressing your gag reflex. I was the patient, actually. I was sideswiped by a car, then ran over by the truck behind while cycling to work. I was essentially impaled by my right femur, which shattered my pelvis and shoved bone fragments into my guts. Last thing I remember before I got knocked out for surgery was the surgeon telling me everything was going to be fine, and it was all routine. I didn't wake up for a month. When I did, I was missing the entire left leg and most of the muscle tissue in the right. I was too weak to move much, couldn't talk because I had a tube down my neck, and was very uncertain about reality due to what I went through in my coma. Parades of doctors came to tell me how I should be dead, and it's crazy that I lived. I was told over and over that my survival was very much against all odds.
My surgeon, on the other hand, never said anything like that. He always maintained that he was going to get me through. His attitude honestly helped me when I had to go back to his table a few more times before I was done. For 4 years, I kinda blew off the people who made a big deal about my survival. I adopted my orthopedic doctor's attitude. Then I met a woman who's in the medical field. I fell in love and eventually trusted her enough to let her read my medical records. I had never read them because it's a massive pile of paperwork. She broke down crying and couldn't read anymore. She told me that the beginning of my time in the hospital was full of the type of write-ups you find in the morgue. She told me that when they opened me up, bits of my pelvis fell out. I asked her to stop there. She won't read anymore, and I don't want to know anymore. I now know my doctor has one hell of a poker face. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me. He just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check, can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it, he stared at it, I stared at it. Then I told him, oh yes, no problem at all, he'd better take a seat and I'd make sure someone was with him right away. Lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, Gale abnormalities, CT brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdomen aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically, all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. Posted this before. 4th year med student here. On my ER rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now, a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walked into the patient room and I'm immediately greeted by a disgusting, rotting flesh smell. Worst thing I've smelled in my life. The patient has to be pushing 400 pounds and has the worst edema, soft tissue swelling from congestive heart failure I've ever seen. His scrotum and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his penis. The nurse had a speculum, tool OBGYNs use to look inside vaginas, inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented piss shit. I still don't know how he let his scrotum and penis swell that much. Edit, we comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ED had ever done or seen anything like it. ER Tech here. A few months ago, we had an elderly gentleman come in presenting with shortness of breath. As I was getting him into the gown and into hospital socks, I noticed very old yellowing bandaging around his foot. I inquired to its purpose, and he told me it was a large wound on the back of his heel that wasn't getting better. I asked if I could unwrap it to inspect it, possibly rewrap it. Basic wound care is one of my duties, and it was a literal hole in his heel about 4 centimeters in diameter, skin necrotic around the edges, with a large flap of skin covering the middle. I wasn't terribly shocked until I swore I saw the skin flap writhe a little bit. I got the patient's consent to look under the skin flap, and sweet galactic Jesus, there were 3 sizable maggots just chilling. I've read about it before, but I have never seen it in person. My brain went, what in the solar fuck? And despite my attempt at a poker face, the gentleman read my reaction and asked, is it that bad? I was straight up with him and told him that the wound had maggots and needed immediate treatment, and the poor guy started apologizing for bringing something disgusting. I told him, I see this more often than you think. Maggots are actually great at cleaning out dead tissue and are used as treatment sometimes. He seemed relieved by that, but it was definitely my first time ever seeing a maggot-infected wound. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid and somehow somersaulted, landing on his ass sitting up. He slid across the intersection, mostly on his ass, getting serious road rash. Luckily, he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass, when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending nurse pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal, and dry heaved.
If you enjoyed this week's effective way to waste time, hit that like button and subscribe for more content like this. If you are enjoying the series, leave me a comment below. A special shout out to the content creators. You frickin' rock.